President.
Senator from Missouri.
Madam President, need to suspend the quorum call.
Without objection.
Thank you for that. I want to talk about the workplace some and the impact of the Affordable Care Act on the workplace. We all saw the story come out yesterday that had tripled the number of working hours, the number of jobs that in 2009, the same group, the Congressional Budget Office, thought would be the victims of moving this way on health care. Now, in fairness to everybody, it was at the time said that if we did this, it would cost us 800,000 jobs. Yesterday said 2.3 million jobs. So it's, I guess, not like anybody who voted for this voted for it without at least somebody saying that was supposed to be an impartial observer that there would be substantial workplace cost. But now that same group, looking at what's happened, looking at the application, looking at the way the law is going to affect, says probably going to be 3 times as many jobs lost because of this, people not adding jobs, people moving from part-time, full-time work to part-time work. And so just another strong indication that the Affordable Health Care Act has not been a good thing for the workplace. And I think we're more and more seeing that the Affordable Health Care Act is not a good thing for health care for most people. I'm sure out there somewhere, just the law of averages, there are people who benefit. I think there are other ways we could have reached out to those same people and included them. But I just brought with me to the floor today some of the letters and emails and other postings that have come in. We've verified all these with the people involved. One, to be sure they didn't care if we used even their first name and where they're from to talk about this. And 2, to be sure that these stories, some of which are just almost beyond belief, that we'd have a program that I believe the people who were for it were well-intentioned that has produced this kind of results. One letter from John in Farmington, Missouri, who says he's one of the founding shareholders of his company and has been since 1975. They've provided insurance since that time, but this year their insurance person came to them and said that there'll be a 50% increase when they renew later this year. They're currently paying, in this small company, $18,000 a month is what they'll pay instead of the $12,000 they were paying. And John's letter, he says, we're a profitable business, but we're not so profitable that $6,000 a month doesn't make a big difference to us when our insurance premiums go up 50%. Lisa in Baldwin, Missouri, says that she's actually an insurance broker, and she contacted us to talk about the examples that many of her clients have had in the way they were affected by the health care bill. One is, I have a family of 5 people, a husband, a wife, and 3 children who were paying $437 a month for their health savings account plan. Their rate for a comparable plan under the Affordable Care Act was $805 a month. So that $437 that family was paying, if they replace that out of everything else they're doing in a given month, it's no longer $437,000 of the budget that goes for health care, it's $805. She says, I've quoted plans for numerous people over the last few months. All have less benefits than what they currently have and are far more expensive. Doesn't say some, it doesn't say most. This is from a person who does this for a living. She says every case that she has quoted that's been higher cost, less benefit. William from Deloge, Missouri, says that his wife had a pacemaker installed 3 years ago. Recently, she called to set up her checkup for the pacemaker with the hospital that they've always gone to, and she was told that due to budget constraints placed on the hospital because of the Affordable Care Act, they no longer provide these services. And so now, according to William, instead of driving 10 miles for these services, they have to drive 60 miles one way, driving 120 miles or to 150 miles even, he says, possibly to get to one of the places they could go in St. Louis. They used to go 10 miles, and the reason the hospital gave is that the Affordable Care Act has created that. Another letter from a broker. I have a client in her late 50s who makes around $20,000 and qualifies for the subsidy. Even with the subsidy, her premium was around that she pays was around $300 a month for the lowest possible level of plan. I think that's called the bronze plan. For the lowest plan, her subsidy, $300 a month, and that was about 50% more than she had been paying for comparable coverage. Someone else, Mark and Janet in Platte City, Missouri, were informed in September of 2013 that as of January 1, their premium would double. Our company, that's what they say in their letter, while we do not think, this is their phrase, that we do not think Obamacare as it stands now is good for the nation, at least it was an attempt to do something. This is people that were hopeful about this, still not critical of those who were trying to do something, says at least it was an attempt to do something about out-of-control medical cost. It needs serious revisions, and part of it should be repealed. People in their 60s don't need maternity coverage, and mental health and substance abuse coverage should not be mandatory either. At least that's the view of Mark and Janet in Platte City, Missouri, and it's my view as well. Mary Ann in Scott City, Missouri says that she's had continuous health care coverage for 36 years without ever having a day without health insurance coverage. After being diagnosed with cancer, her insurance was canceled, and she was forced to get insurance somewhere else. Now, why was her insurance canceled? She had been on the high-risk pool that the state runs. There were ways, Madam President, that I proposed in 2009, and we could all look at another way to do this, to have expanded those high-risk pools. I think by the time the high-risk pool in Missouri went out of existence on December 31, there are slightly more than 4,000 people still on it. Based on my letters, I think eventually we're going to get 4,000 letters. Because what were they paying? They're paying 135% of what would have been the premium that everybody else was paying, but they had a high risk already, and they were generally able to go to the doctors they wanted. They're generally, in the letters we get, no longer able to go to the doctor you want. And your doctor is important, but your doctor is frankly more important to you if you've been sick. If you've been sick, if that doctor has been your doctor through this process, it's something that Mary Ann and others would like to have finished. And let me read one other thing to be sure I fully understand it. As of December 23rd, I was finally able to enroll. It cost me more, and I'm getting less. Unbelievably, healthcare.gov wouldn't allow me to enroll my healthy 18-year-old son. I thought he was the healthy young person they needed in order to make this program work. And she goes on, and that may have just been a website problem. The website will be solved. Like the president said recently that the website was working exactly the way it was supposed to already. And so maybe it has been solved, though I don't think the appeals process is working yet. I'm told there are lots of people appealing information that somehow wrongly got into the website. They can't get that solved. Mary Ann continues to say, the ACA has been a disaster for me and my family. Shame on us for letting this happen. I want my old insurance coverage back. I don't appreciate being mandated at the last minute to buy something that has inferior health coverage. It's administratively inept and costs more. Please resolve this disaster before it gets worse. Myron in Hannibal, Missouri, to quote from his letter, my company told me last November to go to my wife's group health insurance plan because they didn't know how the government plan was going to work out. On advice of my insurance broker, my company got me off their group policy. As a result, my health insurance premium went from $198 a month to $549 a month. Natalie from Meadville says this, my health insurance costs for my family of 4 have doubled and my benefits have decreased. I no longer have office visit benefits and my deductible has gone from $3,500 to to $10,000. I raised my deductible to try to lower my insurance premiums at the end of 2014 when we were forced to sign up. We'll probably cancel our insurance if we think it's just cheaper to pay the penalty. How many letters we have that say my premium's gone up and my benefits have gone down would be a huge number of the people have contacted us. Pat from Kansas City says that she's worried about her kids. Her oldest daughter and her family, her premium went from $5,000 to $10,000 a year. Scott from Lee Summit, he says his premium went up 27% for himself and his son, and he was told that it would have gone up 7% anyway, but the 20% of that 27%, or actually more than 20%, the 20% of the increase was because of the change in health care policies. I think that the more we know the kinds of things we could do to make the health care system work better. I'd like to see us get back to doing that, and until we do, these letters are going to continue to come in, and we're going to continue to try to help these people find a better answer, but the government involvement here may mean that there's not a better answer until the government figures out how to create a bigger marketplace and more choices and let people have the health care they think meets their family's needs, and I would yield the floor.